Okay, all I'm going to do is I'm going to twist and pull this straight up while I'm taking it out, okay? Ready? And you're all done. Okay, we'll just get that wristband off you. All right, good job. Okay, so Karen, we were not able to get IV access, so what we're going to do is we're going to get vascular access by putting it into the bone. So what you're going to feel is it feels a lot like an IV when it's going in. You're going to feel a little bit of pressure when it's going into the bone, and then I'm going to give you some medication once it's in there that's going to help to numb that area up so you won't feel anything after that, okay? Okay. So are you allergic to any medications?
Just penicillin.
Penicillin. Have you ever had lidocaine before?
Not that I'm aware of.
Okay, all right.
When you're ready to place the needle, remove the Easy IO driver from the case and remove the trigger guard if present. Select the appropriate needle set and inspect the packaging for damage. Prepare the Easy Connect tubing that comes with the needle set. If the patient is responsive to pain, consider 2% lidocaine without preservatives or epinephrine, also known as cardiac lidocaine, for anesthesia prior to your initial saline flush. Once your Easy Connect is primed, clean the insertion site according to your institutional policy for aseptic procedures. Next, identify the site. The proximal humerus insertion site is located directly on the most prominent aspect of the greater tubercle. Ensure that the patient's hand is resting on the abdomen and that the elbow is adducted or close to the body. Slide your thumb up the interior shaft of the humerus until you feel the greater tubercle. This is the surgical neck. Depending on patient anatomy, approximately 1 centimeter above the surgical neck is the insertion site. VitaCare recommends the 45 millimeter needle on patients weighing more than 40 kilograms. The humerus is the preferred site for patients who are responsive to pain. Once the insertion is completed, secure the arm in place to prevent movement and accidental dislodgement of the IO catheter. The proximal tibia insertion site is approximately 2 centimeters below the patella and approximately 2 centimeters medial to the tibial tuberosity, depending on patient anatomy. The insertion sites for pediatric patients are the same as those for adults. In small children, generally under the age of 2, the tibial tuberosity may be difficult or impossible to locate. If the tibial tuberosity cannot be palpated, locate the distal aspect of the patella. Move approximately 2 centimeters distally, depending on patient anatomy, and then medial to the flat aspect of the tibia. The distal tibia insertion site is located approximately 3 centimeters proximal to the most prominent aspect of the medial malleolus, depending on patient anatomy. Place one finger directly over the medial malleolus. Move approximately 3 centimeters proximally and palpate the interior and posterior borders of the tibia to ensure the targeted insertion site is on the flat center aspect of the bone. Attach the needle set to the power driver and remove the safety cap.
Okay, now what I'm doing is just coming up and finding that spot again.
Insert the needle through the tissue until it's touching the bone. Verify there is sufficient needle length by ensuring at least one black line is visible above the skin. Power the driver and advance, applying limited pressure until you feel a change in resistance. Stabilize the needle set hub and remove the power driver. Remove the stylet and dispose of in an approved sharps container. We recommend you use the Easy Stabilizer when accessing the proximal humerus and when placing the Easy IO in pediatric patients. In the next scene, we will demonstrate the placement of the Easy Stabilizer. But for the remainder of this video, we will show the catheter in place without a stabilizer for visual clarity. After removal of the stylet, place the stabilizer over the IO catheter hub. Attach the Easy Connect to the catheter hub.
Okay, now I'm just going to be securing these tapes down, okay?
Remove tab 1 on the stabilizer to expose the adhesive. Then remove tab 2 on the stabilizer to expose the adhesive. Finally, ensure that the stabilizer securely adheres to the patient's skin. Prepare the site according to your protocol. Attach the Easy Connect to the catheter hub. If the patient is alert or responsive to pain, consider administering 2% lidocaine without preservatives or epinephrine, also known as cardiac lidocaine, following your institutional policies and procedures. A physician or other authorized prescriber must determine the appropriate dosage range. Medications intended to remain in the medullary space, such as a local anesthetic, must be administered very slowly until the desired anesthetic effect is achieved. If the patient is alert or responsive to pain, prepare them for intense pressure associated with the bolus.
So the rest of this, it's going to have to go in pretty quickly. So it's going to take me about 5 seconds to get that in, so I'm just going to count you through it, okay? Are you ready?
Administer 10 milliliters of normal saline very rapidly over 5 seconds or less.
Doing all right?
Note that the pain will end almost immediately after termination of the flush.
Just a little more of that.
Flush is required to get good flow. Remember, no flush, no flow. Consider additional lidocaine following the flush as allowed by institutional policy and procedure.
Okay, what's your pain level at now?
Probably like a 1 or 2.
Great, great. So now I'm just going to hook this up to our IV tubing, and that's going to run the rest of that medication in.
The pressure in the medullary space is approximately 1/3 of the patient's mean arterial pressure. This is important to remember because the pressure outside the bone in the IV bag must be higher than the pressure inside the bone to achieve flow. Therefore, fluids or medications must be delivered under pressure to obtain maximum flow rates. Rapid fluid infusers can be used for aggressive fluid resuscitation.
I'm just putting a little pressure on that fluid.
Monitor the patient's pain during infusion. Consider repeating lidocaine as necessary for pain control as allowed by institutional policy and procedure.
There we go.
Monitor the infusion site for signs of extravasation.
Good there. All right.
Place the wristband on the patient, indicating the date and time of easy IO placement.
All right, that's it, and we're done. Okay, Karen, we're ready to get this out. So I'll just walk you through the steps as I'm doing them. So I'm just shutting off your IV. I'm just going to take that apart right here. Okay, and now I'm just going to peel this back. All you're going to feel there is just that tape coming off your skin. Doing okay? Mm-hmm. All right. Okay, so now I'm just going to take this off, and I'm just going to pull this right back up and over. So this is just the stabilizer, it's not taking the needle out. And then I'm just putting a syringe on there. So I'm just going to pull this back, okay? Ready? 1, 2, 3. All right. How you doing?
Good.
All right.
Okay.
Now we'll just get that wristband off you. There we go.
Following removal of the EZ-IO, inform the patient that soreness is normal for up to 48 hours. The patient should be able to assume normal activities as soon as their primary medical condition allows. Finally, if the patient detects any signs of infection or other problems, they should contact their primary care physician. Thank you for watching this training presentation. For more information, please visit www.vitacare.com.